Joining me now is the one-time Conservative Health Secretary, Stephen Dorrell, who's now chairman of the NHS Confederation. We're going to talk about the legacy, if you like, of Brexit and the health service. Welcome to you indeed. First of all, I mean, what do you think the impact of Brexit is on the NHS?
Well, on the NHS, it poses a number of problems, most immediately across the health and care system, not just the NHS, but on social care as well. There are issues around the availability of people with the skills we need to continue to deliver the care, both within the NHS and in the social care system. And there's also a question in my mind about how desirable it is to try to build a health and care system which isn't open to the skills that come from outside the UK. That's always been within the tradition of the health service. Looking beyond the workforce issues, there's also, of course, the fact that Brexit, according to virtually all economists, is undermining the tax base of the UK and therefore reducing the availability of cash to pay for the growing health service we need.
Now, I mean, there is one argument which says basically we have employed too many people from the European Union and elsewhere in the health service, and what's more, one of the reasons why we've had to do that is because we've been treating a lot of people from the European Union in the health service, 3 million. Therefore, if we came out of the European Union, then demand would go down, but also we'd be able to train up our own people to fill those jobs.
But the arithmetic simply doesn't work. If you look across the economy as a whole, there are 3 million people from the EU resident in the UK. And we're operating on virtually full employment. So if you assume that people no longer come here from the EU, where will the labour force, not just in the healthcare system, but across the economy as a whole, where will the labour force come from to staff up a growing economy? The question, it's the question the Chancellor of the Exchequer regularly poses. People didn't vote, yes, they voted for Brexit, but they didn't vote to make themselves poorer. And if we don't provide the people to staff the economy, we won't be able to enjoy the growing economy that's been our experience over recent years.
But have we in fact used people coming in from outside, including the European Union, as cheap labour, which is one of the reasons why the government's been able to keep the lid on public sector pay for so long?
Well, I think that the government is facing clearly challenges, both from within the Tory party and more broadly, about the future of the 1% pay cap on public sector pay. But if we're going to deliver decent terms for people from wherever they come working in the health and care system and the broader public sector, there has to be a growing economy to pay for it. And the question that I think has to be answered by those who advocate, in particular those who advocate a hard Brexit, is how it is consistent with a growing economy, improving living standards, improving prospects for young people, as well as improving public services, to plan for a hard break from our most important.
Have we failed in not training enough British people for jobs in medicine?
It's certainly true that we can and should do more to train local people across the range of the health and care system and indeed across the economy as a whole. That is perfectly true. But it's wrong, in my view, either to ignore the fact that we don't live in a society of high unemployment. There are unemployment issues, and we do need to address those. But the economy for a long time now has grown faster because it's had access to people coming from outside the UK.
You've been following the health service and examining it for a very long time now. You know, sort of on a, I don't know, a scale of 1 to 10 or whatever, I mean, how close are we to real crisis, real breaking point, do you think?
I think the first point to make an answer to that question is that we need to look at the National Health Service in the context of a broader health and care system. So social care and broader public services are an important part of the support system for the core National Health Service. I think we're already seeing particular pressure in the social care system, particular pressure in GPs, surgeries, community services, and when those services are under pressure, that leads to pressure in the hospital service. I don't actually think that the concept of a tipping point is the right question to ask. I think what we're seeing is increasing pressure in particular, therefore, on the quality of service that's delivered, despite the commitment of the staff. And unless and until we address some of the fundamental questions there, that will be a continuing trend.
Mr. Dorrell, thank you very much indeed. Thank you.